So Alex, here we are. We're about to do some surgery on you. How are you feeling about it?
Well, I think excited is the main thing. I was a little bit nervous to start with, but now very excited. It's been a long time to make this decision, and yeah, I think now is exactly the right moment. So,
how nervous? Nervous in what way?
I think if anything, it's more sort of excitement rather than nervousness. So it's just looking forward to end of glasses, end of contact lenses. So as sort of as cheesy as that sounds. So
how about anxiety related to what could go wrong?
I mean, there's a little bit of that, but I mean, the number of procedures that I have, seen and done, everyone, complications will always happen, and the key is knowing how to manage them. And I have no worries about that at all.
But you have a low prescription, right? Yeah. How low is that?
It's about -2.25 on the left and -3 on the right. So it's low enough that when I take my glasses off, I can see everything pretty close to this sort of distance.
Right.
But yeah, everything beyond that is pretty blurry. So
you're wearing glasses now,
yes.
But basically you're a contact lens wearer.
Yeah.
What kind of contact lenses did you wear?
Daily disposables. So soft for maybe about 18 years.
Talk to us about the relative risk of contact lens wear. You worked in an eye hospital with an eye casualty.
Well, I mean, certainly, I mean, you see a large number of contact lens-related infections there. A lot of the time, they're relatively straightforward and easily managed, and occasionally they can be blinding. So it's one of those things. It's a risk that you take when you wear contact lenses, but a lot of the time you never think about it. No one really tells you when you pick up your contact lenses from the contact lens practitioner. No one reminds you a few years later about how your contact lens hygiene should be. You just essentially get them, you start, and you get on with it.
There is no consent form handed out by an optometrist, an optician, when they prescribe contact lenses. Contact lenses are a medical device that carry potentially serious complications. The cumulative risk of wearing the safest contact lenses, which are daily disposables, wear those for 1 year, we've now taken the same risk of damaging the vision as having LASIK, and that's for 1 year.
Then if you've worn them for 5 years, then essentially you've exceeded the risk of infection times 5.
Yeah.
So, and same for 10 years and so on.
We'll ask you afterwards how you felt once you've had this done, but what are you looking forward to now, apart from, getting it done with?
I mean, I think the main thing will be being able to sort of explain to patients exactly what the procedure's like, rather than sort of, asking patients, how did you find it? They tell me this, and you then try and use how they've described it to explain to them when you see them properly, but sort of experiencing it firsthand. Yeah. And so many patients have asked me why I haven't had it done before, and it's something that maybe I should have had done 10 years ago, and it was, for some reason, it took me 10 years to make up my mind.
Well, it's an honor for anyone to ask me to do their eye surgery. But an eye surgeon who knows everything there is to know about laser eye surgery, it has an extra bit of honor attached to it. So I'm very, very honored that you've asked me to do your surgery. Okay, we'll see you down there.
Thank you very much.
Okay.
Thank you.
Feels comfortable?
Yeah, that was good.
Okay. I'm just going to set the head back a tiny bit more. That's right. So I'm slowly bringing you closer. And in the middle there, you'll notice the green flashing light that we always talk about. And when the green light becomes clear is when you look directly at it. So that's right. Just keep breathing gently, looking straight ahead into the dark there. And it might get a little cloudy. And then just another few seconds. You're doing very, very well. Perfect. Perfect. And we'll take the pressure off. Fantastic. Very, very good. Okay, and as you know, how does it look there? Very fuzzy.
It's a bit blurry, yes.
Yeah, fuzzy. Keep your eyes closed. Okay. All right, so this is the classic moment. You're going to open your eyes and you're going to compare it to the blur that you had before.
Wow, it's a little bit. It's like rooms being filled with steam, exactly as you and I tell patients.
Exactly.
So it's actually very clear. I can read the words on the clock. I can see.
What word?
It's like mundane, but I can't see the first bit.
What's
MDAINE. Charles Crowe was right. He said it's almost a religious experience when you have your laser.
Yeah. Okay, great. All set.
Thank you very, very much.
You're welcome. Okay. So, how was that?
Yeah, no, unbelievably easy. The hardest part was the drops being put in the corridor. Just, I mean,
Before going in.
yeah, exactly.
Okay.
That was it. Just the anaesthetic drops. You sort of like, you could just feel that a little bit. But in the actual room itself, the procedure was no pain, no discomfort, no pressure. You could just sort of some slightly strange sensations, lots of very interesting bright lights.
Yeah.
And it just went so fast. Yeah,
Great.
No excuses tomorrow. I will have to be at work.
No, I'm afraid I did it well, so you will have to work tomorrow.
No, thank you so much.
You're
That was
welcome.
absolutely amazing.
All right.
Yeah, 10
Very
years.
good.
Wow.